Welcome to Neurodegeneration Awareness and Artificial Intelligence. I'm your host, Dr. Sukant Farana. We have explored neurodegeneration awareness and the role of artificial intelligence in multiple regions, including Middle East, Africa, Central, South America, US. We've traveled most of the world. We recorded East Asia. Now let's look at a very exciting region, which is Europe. With me is Sohit. He is a researcher, a student, and an entrepreneur with interest in both artificial intelligence and healthcare. Welcome, Sohit, to the talk.
Yeah, thanks for having me, Dr. Sukant. It's a very critical discussion.
Absolutely, Sohit. When we compare the European context to, say, GCC or parts of Africa, the starting line of awareness seems quite different, right? How does this impact the conversation around neurodegeneration in Europe?
Yeah, you're right, Dr. Sukant. In Europe, there is generally a higher baseline medical understanding of conditions like Alzheimer's or Parkinson's. The challenge isn't always a lack of basic awareness, but rather tackling more nuanced societal aspects. We see less of the profound over taboos that might lead to hiding a diagnosis, but stigma definitely persists. It often manifests as fear of losing independence, becoming a burden, or the social discomfort around cognitive decline. This is particularly poignant in cultures that highly value active and healthy aging, I would say.
Yeah, very good point. That's an important distinction. The Europe is not a monolith. We see significant cultural variations from Nordic countries with their strong emphasis on autonomy and often advanced dementia friendly initiatives to Southern European nations where family caregiving traditions are deeply embedded, creating both immense support and potential strain. Then there is Eastern Europe, which is on its own trajectory of developing services and public discourse. How do these cultural tapestries influence public perception and approach to care?
Oh, yeah, precisely. In Southern Europe, for instance, while family support is a cornerstone, it can also delay seeking external help or lead to caregiver burnout if not adequately supported. In contrast, in many Western and North European countries, while family is involved, there is often a greater expectation of state or institutional support, though accessing it can be a challenge. The dialogue in Europe is increasingly about quality of life with neurodegeneration, promoting dignity and building dementia-inclusive communities, concepts that can be harder to prioritize when you're still battling fundamental misunderstandings or severe resource scarcity, as might be the case in some regions we discussed previously.
Let's talk about healthcare infrastructure. Europe generally boasts developed systems, but again with considerable variation. We see advanced diagnostic tools, memory clinics, and spectrum of long-term care options. How does this established yet uneven infrastructure shape the role that AI can play, especially compared to regions where the focus might be on building basic capabilities?
Yeah, that's a critical discussion. In Europe, AI isn't just about introducing diagnostics where none existed. It's all about optimizing complex, sometimes fragmented pathways. For instance, AI can analyze medical images with remarkable accuracy, potentially speeding up diagnosis in memory clinics. It can help stratify patients for clinical trials as well, or predict disease progression, aiding in care planning. We're also seeing AI-powered assistive technologies for home environments, aiming to support independent living for longer. However, the challenge is equitable access. A cutting-edge AI diagnostic tool is only useful if it is accessible beyond major urban centers in, say, Germany or France, and reaches rural communities or less well-funded systems in parts of Eastern or Southern Europe.
Yeah, that is definitely true. And this ties directly into insurance and funding. Universal healthcare is an European ideal, but reality of covering long-term intensive neurodegenerative care, especially with high-cost innovative AI interventions, is complex. Germany's long-term insurance is an interesting model. What are the broader European challenges here?
Yeah, the long-term care funding is a massive hurdle. While acute medical interventions are generally covered, the chronic day-to-day support, whether at home or in a facility, often falls into a complex mix of means, tested public funds, significant out-of-pocket payments, and private insurance. This varies hugely. The Nordic countries might have more comprehensive state support than, say, some Mediterranean countries, where informal family care fills the gap, often at great personal cost to caregivers. And when we introduce AI, the question of reimbursement for an AI-driven diagnostic or a digital therapeutic becomes critical. Health systems need robust frameworks for evaluating the cost effectiveness of these innovations. Yeah.
Yeah, this brings us to healthcare workforce. Uh, the key theme, sort of, in these kind of discussions is sheer lack of specialists. In Europe, while there are neurologists and geriatricians, the challenge seems to be more about specialization, multidisciplinary teamwork, and upskilling. What's the role of nurses and physicians, and how's AI impacting their training and practice?
Mm. Europe is increasingly recognizing the need for specialist nurses, let's say like dementia nurses, Parkinson's nurse specialists, who play vital roles in patient education, care coordination, and managing complex symptoms. There are postgraduate programs focusing on neurogeriatrics. However, the integration of neurodegeneration into general nursing curricula and the scope of practice for these specialists varies. For physicians, while neurology and geriatrics are core specialties, ensuring GPs, general physicians, the first point of contact, are confident in early detection is pretty much crucial. Here, the AI tools could support here, acting as diagnostic aids. But this means we need to integrate AI literacy into medical and nursing education. It's not about replacing clinicians, but augmenting their capabilities.
And what about the patients and caregivers themselves? European patient advocacy groups are often very strong and vocal. How does their knowledge base and access to support compare, and how can AI empower them further?
Hmm. Patient and caregiver health literacy regarding such conditions like neurodegeneration is generally higher in Europe, thanks in part to these excellent advocacy groups like Alzheimer Europe and national associations. They are crucial for awareness, support, and even policy influence. However, navigating the available support systems can still be daunting. Here, AI can offer personalized information platforms, tools for self-monitoring or managing medication, and virtual support networks for caregivers. Here, the goal is to empower patients and their families to be active participants in their care, armed with the right information and tools.
Finally, let's look at policymakers. Many European countries have national dementia plans. The EU itself has initiatives like the Joint Program Neurodegenerative Disease Research. How effective are these strategies, and what unique policy considerations does AI introduce in the European context?
Well, it's a mixed bag. Having national plans is a huge step forward, focusing on awareness, risk reduction, timely diagnosis, and even research and development. However, a recent analysis of several European plans highlighted that while they align with WHO recommendations, They often lack consistent funding, regular updates to include new risk factors, or full integration with other chronic disease prevention efforts. So here, implementation is the key. AI introduces another level of complexity for policymakers. They need to foster innovation while ensuring ethical development and deployment, addressing data governance, algorithmic bias, and even patient safety. Furthermore, clear pathways for validation and integration of AI tools into clinical practice are needed. Unlike the MEA region, where policy might focus on establishing basic data collection, Europe is grappling with making vast amounts of existing health data AI ready and ethically usable.
So the conversation in Europe is less about if AI can help and more about how to integrate it ethically, equitably, and effectively into already complex systems. Sohit, this has been an incredibly insightful discussion, painting a clear picture of the unique landscape for neurodegeneration awareness and AI in Europe. What's one key takeaway you would like our listeners to have?
Yeah, that while Europe has made significant strides in neurodegeneration awareness and care, the journey is far from over. AI offers transformative potential, but its successful integration hinges on collaborative efforts among researchers, clinicians, patients, caregivers, and policymakers working together to navigate the technological, ethical, and societal challenges in order to ensure these innovations benefit everyone out there.
A perfect summary. Collaboration and ethical innovation are indeed paramount. Sohit, thank you very much for sharing your expertise with us today.
My pleasure, Dr. Sukant.
And to our listeners, thank you for joining Neurodegeneration Awareness and Artificial Intelligence. We hope today's discussion has illuminated the specific challenges and exciting possibilities that lie ahead for Europe in the fight against neurodegenerative diseases. Join us next time as we delve deeper into neurodegeneration awareness and artificial intelligence. Thank you. Bye bye.